All right. So good evening, everyone. Thank you for joining us for tonight's part 3 of a 4-part Medicare 101 series. Tonight, we're going to be talking about Medicare Part D, or the prescription drug benefit of Medicare. If anybody is having a problem hearing me, please let me know and I can try and turn it up. You can simply unmute and speak up, or you can chat into or type into the chat box. We've got a lot of information to cover, but we're going to try and get through it as quickly as possible. I will pause at different intervals of the presentation to take questions. And again, if you have a question, you're welcome to type the question into the chat box at any time. Or when I pause, you're welcome to simply unmute yourself and ask your question at that time. Hopefully everybody got the email that I sent out just a few moments ago, literally like 15 minutes ago, that included all of the handouts for tonight's presentation. Looks like we got a couple of stragglers coming in, but we'll go ahead and get started. All right. So again, good evening. My name is Roma. I'm with the Area Agency on Aging through the Pikes Peak Area Council of Governments, and this is part 3 of a 4-part Medicare 101 series. I am with the Area Agency on Aging through the Pikes Peak Area Council of Governments, and the mission of the Area Agency on Aging is to develop and coordinate systems and programs that help remove barriers to people being able to live independently in the community in their own homes. The Area Agency on Aging serves 3 counties of the Pikes Peak region: El Paso, Park, and Teller. And I am the coordinator for the SHIP program. The SHIP program is the State Health Insurance Assistance Program, which is a federally funded program that's solely and specifically designed to provide information and education and assistance to beneficiaries, family members, friends, etc., on anything related to Medicare, Medicare A, B, C, Part D, and any kind of insurance that might possibly come in contact with Medicare. The SHIP program serves a total of 9 counties for the Pikes Peak area. Counties are listed on the screen. There should be access to a SHIP counselor in every county of every state of this country. In Colorado, on the slide, as I've listed our local phone number here in Colorado Springs, as well as the statewide toll-free number. Our services are free, and we provide unbiased, confidential information and assistance, one-on-one counseling, and we are available to help with any questions or concerns anybody may have about Medicare. Just a quick note, Medicare at a national level is doing an ongoing survey. The survey is used to gauge people's satisfaction with the SHIP and SMP programs to make sure that we are basically doing our job right and making sure that we are providing accurate information. So if you do happen to get a call from a company that is wanting to see if you will answer some questions about your SHIP interaction, please feel free to answer those questions. It is a legitimate call. Again, this is an ongoing survey, so the federal government will be surveying a small percentage of the population in every state, roughly every month. Just a quick review of the topics we've covered so far. Week 1, we covered Medicare Part A and Part B, eligibility and enrollment. Week 2, we covered Medigap and Medicare Advantage plans, also known as Medicare supplements or Medicare Part C. And again, this week we are going to be talking about Medicare Part D. D stands for drugs. It's the prescription benefit for Medicare. So what is Medicare Part D? Medicare Part D, again, is the prescription drug benefit of Medicare. It is pretty much the newest benefit of Medicare. It became available and effective in 2006. Prior to 2006, Medicare did not pay for drugs in any way, shape, or form unless they were provided to you while you were inpatient in a hospital. The Part D benefit of Medicare is for outpatient drugs only. So basically it's for medications that you go to the doctor's appointment or the doctor's office, they hand you a paper script, you take that to the pharmacy and you pick up your medications. That is the purpose of Medicare Part D. Part D plans through Medicare do have some things you need to be aware of, such as formularies, tiering levels, premiums, copays, all of that kind of stuff. And we're going to talk about all of that tonight. For standalone Part D plans, there is going to be a monthly premium in addition to what you pay for Medicare and or Medicare Supplement, Medigap, or perhaps even a Medicare Advantage plan. You will have deductibles and copays at the pharmacies. But if you have limited or low income and resources, you may qualify for what they call extra help or low income subsidy that would significantly reduce some of those costs at the pharmacy. And we will talk about that as well. So should you enroll in Part D? Well, just like with honestly any other part of Medicare, Medicare Part D is optional. However, to be eligible to enroll, you only need to be enrolled in Medicare Part A or Medicare Part B or both. For the other programs we've talked about so far, typically you need to be enrolled in Part A and Part B, but for Part D benefits, you only have to be enrolled in Part A or Part B, and that can be a very important distinction. Reasons you wouldn't necessarily have to enroll in a Part D or want to enroll in Part D is if you currently have any other type of what's deemed credible drug coverage. And for example, that could be drug coverage you have through current employment, an employer group health plan. If you use the VA pharmacy for your pharmacy benefits, that's considered credible and you wouldn't necessarily need to enroll in a Part D. If you have credible coverage and you use that credible coverage instead of enrolling in a Part D, if for some reason you needed or wanted to enroll in a Part D down the road, you would not be penalized for not enrolling now. As long as you have credible coverage through any other source, you can delay enrollment in Part D without penalty. And if that credible coverage ever goes away for some reason, you would be able to enroll in a Part D based on the fact that you lost that other credible coverage at any time without penalty. But you would want to consider a couple of things when you are deciding whether or not to enroll in a Part D, especially if you currently have other drug coverage. So things that you might want to consider or compare would be the cost of your medications through Part D versus the cost of your medications through your current coverage. The premiums that you would pay to have an additional Part D plan versus the premium that you pay to have that other credible coverage. If you choose not to enroll in a Part D plan and you don't have other credible coverage, and I get this question a lot because I do have many beneficiaries who say, well, what if I don't take any drugs? What if I don't have any medications that I need to worry about getting payment on? And that's a very legitimate question. But unless you have other credible drug coverage when you become eligible for Medicare Part D, if you don't enroll in Part D, but want to enroll or need to enroll in Part D later, you may be penalized. And that is simply because Medicare does not want you to wait until you have a really expensive medication need before you choose to enroll in a Part D plan. They want you to pay equally like everybody else, whether you need to use it or not, honestly. And we'll talk about that a little bit more as we go. Enrolling in Part D, there are several different enrollment periods that you may be able to take advantage of. The initial enrollment period, as we talked about in weeks 1 and 2, will follow along with your initial enrollment period into Medicare A and B, which is going to be the 7-month period that surrounds your 65th birthday, basically. So it'll be the 3 months prior to the month of your 65th birthday, the month of your 65th birthday, and up to 3 months after the month of your 65th birthday, or whenever you become eligible if you're under age 65. That's your initial enrollment period. But with Medicare Part D, as with Medicare Advantage plans, there is an annual, what they call an annual election period. We simply refer to it as open enrollment every year. That open enrollment period every year is October 15th through December 7th. Any change or enrollment you make during that October 15th through December 7th window, whatever you do in that window goes into effect January 1st of the next year. And then special enrollment periods. A special enrollment period comes into play when, for example, you have that other credible coverage today and you choose to use that coverage instead of enrolling in a Part D, and then sometime down the road that coverage goes away. When you lose that credible drug coverage, you would get a special enrollment period to be able to enroll in a Part D without penalty and without delay. Again, if you choose to wait to enroll in a Part D plan and you do not have other credible coverage in place of Part D, again, that's your choice. You can do that. But if for some reason down the road you need to enroll in a Part D or want to enroll in a Part D, you may be penalized, just like if you wait to enroll in Part B. However, the penalty for Part D is calculated much differently than for Part B. For Medicare Part D as in drug, the penalty is going to be a 1% penalty, but it's 1% for every full month that you were without Part D drug coverage and didn't have any other credible drug coverage in place of it. That penalty is going to accumulate over time. So if you wait a year to enroll in Part D, you're looking at 12% penalty for 12 months. The longer you wait, the higher that penalty gets because it continues to accumulate over time. You wait 2 years, it's a 24% penalty. But that penalty, when it is assessed, if it is assessed, would be based on that year's national benchmark premium. So basically the national average monthly premium for Part D plans across the country. So the amount of penalty tends to be much smaller for Part D benefits than it is for Part B, because Part B penalties are based on a much higher monthly premium, $148.50 this year. The Part D penalty, if it were to be assessed for 2021, would be based on the national benchmark premium of $33.06. So even if you're looking at, 12% of $33, that's going to be a much lower amount of penalty than for Part B as in boy. But as with Part B penalties, Part D penalties last forever. So once they're incurred, they never go away. Unless somehow you become eligible for extra help based on lower income and assets. Also, as with Part B, Medicare Part D premiums can be higher based on income. So they are means tested, meaning the more annual income you have, the more you might have to pay for Part D drugs, Part D plan. Just like with Part B, the income levels are going to be the same as they are for Part B. So if anybody has an income of up to $88,000 for an individual or $111,000 for a married couple who files jointly, then or $176,000, I'm sorry, then you wouldn't have to worry about paying a higher Part D premium. If you have an income greater than that, you would look at having to pay an additional premium on top of the base premium for the plan that you choose to enroll in. For incomes higher than $88,000 or up to $111,000, you'd be looking at an additional $12.30 added to the premium of whatever plan you choose to enroll in for 2021. So again, the higher the income you have, the higher Part D premium you may have to pay. But the starting threshold for those income limits can be quite high. And again, Medicare and Social Security are basing whether or not they impose a penalty on you on the most complete, most recent tax filing that they can access, which is going to be old information. So if in 2019, your income was greater than $88,000 a year, but 2 years later in 2021, you've since retired and your income is now less than 88,000, you may initially get a letter from Social Security saying that you have to pay this Part D penalty based on the information that they had access to. However, you would have the ability to dispute that and tell them that you no longer are at that income level so that they wouldn't impose that higher premium, you wouldn't have to pay it. So you're never going to be forced to pay a higher Part D premium or a higher Part B premium based on income that you may no longer have. There's always going to be a process to correct that. All right, any questions about any of that so far? Again, if you have questions, you can simply unmute and ask your question, or you can always type it into the chat box. All right, I'm not hearing or seeing any questions, so we will move on. So now we're going to talk about what Part D covers and how it works. So Medicare Part D benefits are based on an outline of coverage created by Medicare. So Medicare has created this outline of coverage, or this base level of coverage. And this base level of coverage is the minimum amount of coverage any Part D plan can provide to you. So this is the least amount of coverage that any Part D plan can offer. Most Part D plans do better than this base level of coverage, but this is the minimum that they have to provide in order to be within the requirements of Medicare and providing a drug benefit. So Medicare's basic outline of Part D drug coverage dictates that there will be a deductible every year. For 2021, that deductible is $445. What that means is if you have a Part D plan that has a deductible of up to $445, when that plan goes into effect and you go to the pharmacy for the first time to get a refill or to pick up a new medication, you're going to show the pharmacy the prescription, you're going to show the pharmacy your drug plan card, and that drug plan is going to be billed for that drug. And the pharmacist may come back and say, you have to pay full retail price for your medication. You will have to pay full retail price for any medications you pick up until you spend up to $445. Once you've spent that much in retail costs, the next time you go to the pharmacy, your cost of out of pocket for your medication should be much lower in the form of a copay. That much lower cost is representative of approximately 25% of the retail cost of that medication. So you pay 25% as a copay, and then the plan picks up the other 75% of cost of that medication. You will continue to pay a copay of up to 25%, and the plan will continue to pay their 75% until the total drug cost, meaning the full retail cost between what you paid during deductible and what you paid after deductible. They're taking the full retail cost every time you go to the pharmacy, and they're adding that cost month after month. And when that total retail cost reaches $4,131 for the year, you will have hit what's called the coverage gap, or the donut hole in your drug coverage. When you reach the donut hole, your cost could potentially increase at the pharmacy. Now, technically, the donut hole, which when Part D started in 2006, when someone hit the donut hole in their Part D coverage, they basically went back to paying 100% full retail cost for their drugs when they hit that donut hole limit. Over time, over the last 20 some years, what has happened is that what you pay in the donut hole has gradually reduced from 100% down to 25%. So if you hit the donut hole within a calendar year, the most you'll ever pay for your prescriptions is 25%, and that's both brand name and generic. Now you may be sitting there thinking, well, isn't that what I was paying after deductible was 25%? Theoretically, that is true. However, as I mentioned before, this is the basic outline for Part D coverage, and most Part D drug plans do better than this basic outline. So, for example, if you enroll in a Part D plan, you may have up to a $445 deductible, or you may have a plan that pays the deductible, or you may have a plan that pays part of that deductible. You may also have a plan that once that deductible is met, if you go to the pharmacy with a generic prescription, that plan may have a $0 copay for that generic prescription, or $1 or a $2 copay for that generic prescription. However, again, while you're in the initial coverage zone, even though you're paying $0 or $1 or $2 copay for that generic prescription, the plan is still taking the full retail cost for that drug and adding it up towards that $4,100 limit. So during the initial coverage level, you're paying very little potentially, but once you hit the coverage gap or the donut hole, that $0 or $1 or $2 copay could change to 25% of retail. So that's when you would notice a difference in what you're paying and when you hit the donut hole. On the other hand, it may work the other direction. You may be paying a $60 copay for a brand name drug. And if you hit the donut hole, you realize that 25% of the cost of the retail cost of that brand name drug is less than $60. Your cost for that brand name drug may actually go down in the donut hole. So it can actually work both ways. While you're in the donut hole, the drug plan is still adding some of your costs towards another limit. So they're continuing to add on to that $4,100 limit that you reach to get you to the donut hole. But to get you to the donut hole, they were adding the full retail cost of every drug you purchased. When you're in the donut hole, they're only adding the 25% copay that you're paying for that drug towards the next limit. So once you hit the donut hole, they're going to add the 25% copay that you're paying for your drugs on top of that $4,100. And if for some reason you reach before the end of the calendar year a total of $10,048.39, then you would reach the last level of coverage, which is considered catastrophic coverage. If you hit catastrophic coverage in your drug benefit, your copays at the pharmacy would go down to 5%, or a copay of $3.70 generic or $9.20 brand name, whichever is greater. And then come January 1st, the cycle starts all over again. So again, this is your basic outline. This is the minimal benefit that any Part D plan can offer you. But again, most plans do better than this basic outline. So it's not as bad as it may look based on this chart. Requirements by Medicare for Part D plans as far as the specific drugs go. Well, actually, let me address a question before we move on to this part. So I have a question that says, does the $4,100 leading up to the donut hole reset each year like the deductible? And the answer is yes. So again, regardless of whether or not you hit the donut hole, regardless of whether or not you ever hit catastrophic coverage, everything resets January 1st the next year. Whether you keep the plan that you have or you change to a new plan, doesn't matter. Come January 1st, because everything is going to be based on a calendar year, come January 1st, everything resets, the deductible and everything. So hopefully that answers your question. Okay, so as far as the actual drug coverage, what drugs are covered, Medicare requires every Part D plan to provide at least 2 medications for every medical class of medication. That's important because for some medications, there may be 50 different drugs for that specific class of medication. So for example, if you take a cholesterol medication, there may be 20 different cholesterol medications on the market, but Part D plans are only required to cover 2 of them. And each Part D plan out there may cover a different 2 drugs out of those 20. So most Part D plans are going to have different formularies from the next Part D plan. So it becomes very important to be aware of that and to make sure that any Part D plan that you may be looking at covers your very specific medications. There are 6 classes of medication, medical classes of medications that Medicare requires Part D plans to cover any and all drugs that might be available on the market. Those 6 classes are the antidepressants, antipsychotics, anticonvulsants, antiretrovirals, immunosuppressants, and antineoplastics. Anything on the market in those 6 categories, every Part D plan must have on their formulary. Part D plans are only allowed to cover prescriptions that have been approved by the FDA and that are being prescribed for their approved medical purpose. For example, if a doctor is trying to prescribe Viagra to someone for high blood pressure, because they've realized that that may have that secondary benefit, unfortunately, because Viagra was not created for that purpose, Medicare will not cover it for a different purpose. Now, Viagra is not covered by Medicare at all because it's not considered a medical necessity. But even if it's prescribed for medical necessity, such as high blood pressure, it would not be covered because that's not the reason it was created. That's not the purpose it was created for. The other thing, when I say approved by use by the FDA for use, you also should realize that there are some medications out there that predate the FDA. And so there are some very common medications that have been out in the world for decades and decades that may not be approved by the FDA. That is not uncommon. All Part D plans must include drugs, including biologicals and insulin. They must include coverage for the supplies for injecting insulin, such as the needles, the syringes, the alcohol swabs. And every Part D plan must include both generic and brand name drugs on their formularies. So when I say that every plan must include at least 2 drugs in every class, every medical class of medications, that list of drugs they choose to cover is considered their formulary. And again, every plan may have a different formulary or list of drugs that they will cover specifically. Some things not covered by Part D specifically are going to be any medications that were already covered or would be covered under Medicare Part A when you're admitted to a hospital, or Medicare Part B. Medicare Part B drugs would be drugs that you go to the doctor's office once every 3 months to get an injection, but it has to be done at the doctor's office by a nurse or the doctor. That would be considered a Part B drug, because again, Part D drugs are only for the drugs that you go to the pharmacy to pick up. Part D also does not usually cover anything considered over the counter or not requiring a prescription. Drugs that require prescription but are used to treat specifically anorexia or for fertility purposes or for cosmetic purposes only would not be covered by Part D. Even if it requires a prescription, if it's solely and specifically designed to relieve cough and cold symptoms, guaifenesin or robitussin is a good example of that. It is not covered by Part D. And most vitamins and minerals, otherwise known as supplements, are not covered by Part D, with some exceptions. If it's used for a specific reason, such as prenatal medications or drugs, fluoride treatments, vitamins to treat specific diseases. Otherwise, most vitamins and minerals would not be covered under Part D. Now, having said that, Part D plans would be allowed at their discretion if they choose to offer discounts on some of these things. But it can't be considered a Part D benefit, and it can't be billable to Medicare as a Part D benefit. But there are some plans that may offer discounts on those types of medications. Any questions about any of that? Again, you can unmute or type it into the chat box. Okay, it looks like I do have a few questions in the chat box. First one is, how do we find out how much retail is for a drug? How much the retail cost is? Well, I mean, there's no simple way to find that out. When Part D first came out, you used to be able to get retail cost quotes from places like Walgreens on the internet. Once Part D came out, that didn't last very long. You can always call the pharmacy and ask them what the retail price is for any medication. You can use the Medicare.gov plan finder, and it will tell you the estimated retail cost at the pharmacies that you pick for the plan finder, so that you can compare the different prices from pharmacy to pharmacy, and the retail price will vary from pharmacy to pharmacy. In some cases, it can vary significantly from pharmacy to pharmacy. Another fact that most people don't realize is the retail price can vary from day to day. The retail cost of medications can usually be based on a market value that changes daily. So you may call for a retail price quote to, say, Walgreens today, and then you call the same pharmacy for the same price quote tomorrow, and it may be slightly different. Regardless of that, your copay would still be the same through Part D. The plan finder is probably going to be the most effective way to get Part D retail costs, or the retail cost of drugs, so that you can compare that to the Part D plan benefits. And that is part of the plan finder, which is very useful. Next question is, can you enroll in a Part D when you first become covered by Medicare, but then opt out the next year without other credible coverage and re-enroll in the third year? Or would there be a penalty for re-enrolling? Can you do this if you have credible coverage that second year? And the answer to all those questions is yes. So again, you can get into or out of a Part D plan during any annual open enrollment period at your discretion. However, if you drop Part D altogether and you don't have other credible coverage in place of it, when you go to re-enroll, you would be looking at penalties for having not had any drug coverage and not being enrolled in a Part D. But if you drop a Part D plan because you have other credible coverage for a year or however long, when you go to enroll in a Part D afterwards, you would not be penalized because you had credible coverage. So again, the answer to all of your questions is yes. Next question is, how about insulin pump supplies? I heard that insulin via pump is considered an infusion, and via pump is a specialty drug. So typically, if you are getting insulin by a pump, which is a device attached to your body that injects insulin whenever you may need it, or on a consistent basis because you need that much, most of the time that insulin pump equipment and the insulin that goes with it will be a benefit of Medicare Part B as in boy, because you would get that equipment through a durable medical supplier. However, if you have purchased a Part D insulin pump or an insulin pump and you purchase your own insulin to put in it, that could be a Part D benefit because you would be getting the insulin at the pharmacy on your own. So it could go either way, depending on the situation. And it could depend on the type of Part D coverage you have. For example, some Advantage plans that include Part D at no extra cost may view an insulin pump as a durable medical supply, so it would always be under Part B, when most Part D plans may consider it a Part D benefit and always bill it under Part D. So it really just depends on the specifics of your situation or the person's situation who has that insulin pump. So unfortunately, that's not a clear black and white answer. I apologize. But we would be happy to discuss that in more detail if you needed more information.
I have a question for you.
Yes, sir.
My benefits started on July 1st for A and B. I actually retired the 21st of June, but my benefits for Social Security start on July 1st.
Okay.
So you said in order to enroll in the D, this would be considered a special enrollment period, I would think.
Was your benefits started after you initially became eligible because you continued to work, for example?
No.
So because your eligibility is based solely on the fact that you became eligible for Medicare based on turning 65, I'm assuming, you're in your initial enrollment period. So you're in that enrollment period that's 3 months prior to the month of your birthday, the month of your birthday, and up to 3 months after the month of your birthday to enroll in Part D.
Right, I see my birthday is January 30th of this year. So you said there was only so many months before and after. So that would take me out of that eligibility, wouldn't it?
Oh, so I thought you said July is when your benefits started. They don't start.
That's when I started collecting Social Security benefits, yeah. My
But
birthday.
Okay, but Medicare doesn't start until January. Is that what you're saying?
No, it's already started. But you had mentioned October 15th to December 7th.
Oh, that's the annual enrollment period. So if you enroll in Medicare A and B and D, when you were eligible for July, in October 15th through December 7th, you would be able to look at what Part D options are available for 2022 to see if there's a better plan in 2022 than the plan you enrolled in for 2021.
Okay, currently I don't have a D, so I'll have to wait for that period.
So if your birthday was in July,
No, my birthday was in January.
last January,
January 30th of this past year.
okay, and that's when your Medicare started.
Well, my Medicare A, I already had from December of 2020. I signed up for it, but
Okay.
I didn't retire from work until June 21st of this year.
Okay.
So I was still able to enroll for benefits. I had A, so I was able to get A and B plus my Social Security benefits.
Okay, so because you continued to work past your initial enrollment period, past January, when you stopped working and lost employer coverage, that would put you in a special enrollment period. The special enrollment period is only about 63 days to get into a Part D without penalty. So
That's what I was getting at here.
yeah, so if your coverage ended July 1st, you'd have the month of July and the month of August. So you'd basically have until the end of August to enroll in Part D without penalty for the rest of 2021.
Okay, that's what I needed to know right there.
Yeah. Yep. So as long as
If not, I would have to wait. Not, I would have to wait till October 15th or through
Correct.
December for 2022. Okay.
correct, and then you would have a small penalty of about 6%. Because you'd be without coverage between July and December.
Right. Okay.
But as long as it's enrolled before the end of August, you're good to go.
Okay. Thank you.
You're welcome. Next question is, King Soopers Pharmacy shows retail price on the paperwork for prescriptions. Yes, and most pharmacies do, but that's usually after the fact, after you've already paid for the prescription. So it wouldn't be something that you could use to get a retail price estimate prior to having to shell the money. Can you use Part D for some meds and use GoodRx for other meds? That's a good question. Prior to 2020, there had been basically a gag order on Medicare Part D pharmacists that said that they were not allowed to tell you at the pharmacy if you could get a particular medication cheaper by not using your Part D. It's not an order that was in effect for very long, but it was in effect for too long from day one, as far as I'm concerned. That had been lifted, that has been lifted. So if you go to the pharmacy and show them your Part D card and the copay with Part D is $20, the pharmacist happens to know that you can get that same drug with GoodRx for $10 or their own discount program for $12, they're allowed to tell you that. If you find a better price through GoodRx or one of those drug discount apps, you're absolutely welcome to use that lower price discount. However, whatever you get, whatever discount card or program that you use and spend money on does not go towards any Part D expense. So it does not go towards your deductibles. It does not go towards your coverage limits or coverage levels. So you're absolutely welcome to use something like GoodRx instead of your Part D if it's going to be a lower cost to you. But just keep in mind, none of that goes towards your deductibles or other expenses for Part D. But absolutely, if it saves money, I don't have a problem with it. Government doesn't have a problem with it. That's a good question. All right. Any other questions before we move on? I do have a question about the recording notation. I'm not quite sure what you mean, Mr. Andrew. But I don't think there's anything affecting the actual recording of this, and this recording should be posted in a couple of days. So, as I mentioned before, there could be financial assistance for people who have limited or low incomes, specifically for Part D costs. Low income subsidy, otherwise known as extra help, is a financial assistance benefit that you can apply for directly through Social Security. If Social Security deems you automatically eligible based on what they pay you in Social Security income, or based on the fact that you may already be enrolled in some other type of financial assistance program, you would automatically be eligible and enrolled in extra help. There are several levels of extra help that you can qualify for. The income and asset limits are higher for Part D extra help than they are for the Medicare savings programs, which helps with Medicare Part B expenses. So more people should qualify for help with prescription drug costs than may qualify for help with Part B costs. To apply for this assistance, you can either call Social Security at their toll-free number, their 1-800 number, which I have listed on the slide, or you can go to their website, ssa.gov, and find the low-income subsidy application. Or you're always welcome to visit us, give us a call. We can do these over the phone, or call us and schedule an appointment. We can do them in the office. The application for this specific assistance takes literally 10 minutes or less. And if it's done on the internet through the website for Social Security, the response turnaround from Social Security is typically 2 or 3 weeks for them to determine whether or not you're eligible for that assistance. Income limits for this program, again, as I mentioned, are slightly higher than for the other assistance program that I've talked about in the last couple of weeks. For a single person, $1,630 in 2021. For a married couple, $2,198 per month. Again, these are in gross amounts or pre-deduction dollars. So whatever total income you have from any and all resources, whether it's Social Security only or Social Security and a pension and whatever, all income sources added together, pre-deduction. Asset limits are also higher for this program. So again, more people should qualify for assistance with Part D than with other assistance programs. Any level of eligibility and approval accomplishes a couple of things. It always eliminates the donut hole. So your costs would never increase if you hit the coverage limit. It reduces copays at the pharmacy. Depending on the level of assistance that you qualify for, it can either totally eliminate the premiums for Part D, totally eliminate the deductibles for Part D, and reduce copays to a maximum of $3.70 copay generic, $9.20 copay brand name, regardless of the retail cost. And that's at the lowest income level, the highest amount of assistance. And at the highest income level with the lowest amount of assistance, it will still eliminate the donut hole. It will reduce the deductible to, I think, $82 this year. It will reduce copays to 15% maximum. So any level of assistance can be a huge money saver for anybody who may qualify. Again, we help with these applications. We're happy to assist, and we can do them over the phone in 10 minutes or less. So if anybody is interested in any additional information, please feel free to give us a call or shoot us an email. Other ways you might be able to get assistance, specifically for some of the more expensive medications that might be prescribed to you these days. And when I say some of the more expensive, I'm basically referring to any medication the doctor prescribes to you that you may still see a commercial on TV for. If you see a commercial on TV for a prescription medication, I can guarantee you that medication is expensive. For the people that may not qualify for the extra help, but may not still be able to afford the cost of those really expensive medications if they hit the donut hole or the coverage limit, there could still be some financial assistance out there for those types of drugs directly from the drug makers, patient assistance programs. There are several ways we can find out if any particular drug has a patient assistance program that someone can apply for. The Medicare.gov website through the Plan Finder can provide that information. I've also listed several other websites that people in this business use to help people find that information out. These websites are specifically designed to tell you whether or not a specific drug and the maker of that drug offers patient assistance. Patient assistance programs tend to be much more generous in the amount of income they will allow someone to have to qualify and assets. So if your income is too high for extra help, but it would be a struggle to continue to afford to pay for those higher cost medications if you hit the donut hole, we can always look at patient assistance to see if there's financial assistance available that way. For people who qualify for patient assistance on those types of medications, typically, once you are eligible and qualified, you will usually get that medication at no cost for the rest of the calendar year through that program. And again, we can help you with that information and looking those kinds of things up. So, things to consider when you're looking for a Part D plan. And just so you know, I can tell you that there are a total of 27 standalone Part D plans in Colorado this year. And that's just standalone plans. That does not include Part D coverage that would be included in an Advantage plan. And there are, I want to say, 20 Advantage plans in El Paso County specifically that include Part D benefits. Each and every single one of those plans, whether it's a standalone plan or through an Advantage plan, again, may have a different formulary or a different list of drugs that they cover specifically. Whenever you're looking for Part D benefit, you always want to make sure, first and foremost, that whatever plans you're looking at cover your specific medications. If you get on the phone with an agent or salesperson, or you call one of those 800 numbers that you got off the TV commercial, I can tell you for a fact that those representatives do not always make sure that your specific drugs are covered by their drug plans, which I think is unfortunate, but that makes it all the more important that you are aware that that is something you need to address. First and foremost, you want to make sure the plan covers what you take. Once you find plans that cover what you take, then you can start comparing the plans by cost, premium, copays, deductibles, that kind of thing. Other ways you might be able to do that would be the hard way. You could either call each and every plan and ask them if they cover all of your medications and what the copays for those medications are and what the premiums for each plan are, and add all of that together and see which plan comes out as the most cost effective. You can contact an agent or a broker in hopes that they would do that for you, but keep in mind that they're only going to provide you with the information for the specific plans that they sell, or agents who are dedicated salespeople for a specific insurance company, or brokers who can sell multiple insurance plans for multiple companies, who may still limit the number of companies that they sell. Or the most effective method would be to go to the Medicare.gov plan finder. The Medicare.gov plan finder is basically a search engine that allows you to put in all of your specific medications, your pharmacy preferences, all of that kind of information, and it will do all the math for you. And the end result is it will show you which plans are going to be the most cost-effective plans to enroll in based on all of your specific medications and what those plans will cost you. So it does all the work for you. That is the primary tool that our program uses during open enrollment to assist people. During open enrollment, we literally see hundreds of people who come in for assistance with looking at their drug plan options or their advantage plan options during open enrollment to see if there's a better deal out there for the next year. We're happy to do that. We love to do that. I will be doing some classes in the next couple of months on how to use the plan finder, like a demonstration. So keep an ear out for that, or go to our website and look under our events and register for that. But the plan finder is literally the most effective tool to try and find the most comprehensive and least expensive Part D plan benefit available to you based on your needs. One of the easiest way to use the plan finder is to create a Medicare.gov account. Again, Medicare allows you or has the ability for you to create a MyMedicare.gov account, which allows you to save your drug lists, your pharmacy preferences. It allows you to look at any claims that have been submitted on your behalf from medical providers in real time. It has a lot of benefits, and it has a lot of useful information that you can get out of it by having that account. Medicare does not require that you create a My Medicare account, but they do strongly encourage it. It takes literally minutes to create a My Medicare account. I did include this handout in week 1 for those that are looking for it. How to create a My Medicare account was a handout I included during part 1 of the presentations. I'm going to give you a brief glimpse of the plan finder for the last part of this presentation. But before we get into that, I'm going to pause one more time to see if there are any questions. I'm not seeing any questions in the chat box. And I'm not hearing anybody speak up, so I'm assuming everybody is crystal clear on all of this. And did I mention there is a test at the end? I'm not hearing any laughter either. All right, we'll move on. All right, so this is just going to be a brief overview of the Medicare Plan Finder from the Medicare.gov website. What we're looking at here is the homepage of Medicare.gov. Now, having put this presentation together, I can tell you that we just found out this morning during a training that we took from Medicare Online that they have made some tweaks to the webpage, to the website, and to the plan finder. So it may look a little bit different than what we view here. I did not have time to change the slides after I found that out after 1 o'clock today. But it will be basically the same. And this is just going to give you a general idea of what you can do on this website. So for Medicare.gov homepage, and if you're going to be looking at what drug plans are going to work best for you, you're going to want to click on the button that says Find Health and Drug Plans. Once you click on that button, it's going to take you to a page that's going to ask you to either log in because you already have an account, or it's going to ask you to create an account. But if you look at the little tiny print below that button, it does allow you to also log or continue in the plan finder without logging in or creating an account. Once you get past this page, then you can start adding in your specific medications. And what you're going to add in is the specific medication you take, the quantity you take, and the specific dosage you take. And you will continue to add all your medications in because all of those specific details are very important when it comes to the costs. Once you're done adding the medication, you will be asked what your pharmacy preference is, and you will be able to pick up to 5 different pharmacies to compare. Copays can vary with the individual drug plans from pharmacy to pharmacy because some plans have chosen to contract directly with some pharmacies to offer better deals for their beneficiaries if they go to those pharmacies. So for example, there is a Part D plan called the Humana Walmart plan. Basically, that means Humana and Walmart have contracted with each other so that if you have that plan and you use the Walmart pharmacy, your copays will tend to be lower than if you go to a different pharmacy. Now, that does not mean you can't go to a different pharmacy. You can go to pretty much any pharmacy you want, and most pharmacies are going to be available. There are very few plans that have no contract with any pharmacy, and they would be considered out of network, which means you pay full retail costs with your Part D plan if you went to that out of network pharmacy. But if you go to a pharmacy that is not preferred, you may still pay a higher copay than if you went to a preferred pharmacy. So there's a lot of different factors that go into determining what plan is going to be your best deal and save you the most money. Again, as SHIP counselors, we help people through this process. We help people interpret the results, and we help people with the enrollment process. We're happy to do that at any time for anybody who's eligible. We're happy to just walk you through that process so that you can do it on your own. So whichever works best for you, we're happy to help in any capacity. Once you've added all that information into the system, your drugs and your pharmacy preferences, again, it's going to do all the math for us. And the end result is it's going to list all 27 Part D plans available in Colorado this year in order of the plan that's going to save you the most money down to the plan at the bottom of the list that's going to save you the least amount of money on your specific medications. Incredibly useful tool. Basically, open enrollment would be impossible without this tool. So, again, I'm going to be doing some presentations that are basically going to be a demonstration of this website in the next coming month. And I'm happy to help you individually. Any of our counselors are able to help you individually to walk you through it, or just run it through your medications to see where you end up. We're happy to do that anytime. I got a couple of quick questions before I move on I want to address. So first question is, can you change your plan selection within the sign-up period if you already picked one? So I'm assuming you're asking if you, between October 15th and December 7th, if you enroll in a plan, and then before the end of the enrollment period, before December 7th, you decide you want a different Part D plan, can you enroll in a different one instead? Technically, yes. Theoretically, you shouldn't do that. And there's no guarantee that whatever secondary plan you choose to enroll in would be the one they enroll you in. It all may depend on the timing. So it's not encouraged that you do that, make multiple enrollments within that window of time. I.e., that's why the plan finder exists, so that you don't have to second guess it. The plan finder is going to tell you what plan is going to be the most effective. So they discourage you second guessing and doing a second enrollment, but I'm not going to say that it's impossible. Next question is, my doctor wants to put me on a new and expensive medication. Since I don't know the strength or dosage, is there any way to find it through the plan finder? So the plan finder, when you add medications, and this is wonderful part, not only will it start to auto-fill in the word, because sometimes the spelling of these medications can be a little tricky. So once you start typing, it starts auto-filling in, and you can just wait until it gets to the right medication. But once you pick a medication, the next page is going to ask you for the dose and quantity, but it will automatically have a default selection for that. So it's automatically going to default to the most commonly prescribed dosage and quantity, and then you can alter that from there. So you can always get an estimate based on the most commonly prescribed dosage and quantity, and then adjust that after the fact once the doctor prescribes it. And then last question before we move on, do we use the My Medicare online account to enroll in A, B, D, or G, or use Medicare.gov to enroll? So to enroll in Medicare A and B, you have to go through Social Security, period. Only Social Security can enroll you in Medicare A and B. For D, you would absolutely be able to enroll through the Medicare website, the Medicare Plan Finder. At the end of that process of adding your drugs in your pharmacies and it giving you a list of the most cost-effective plans at the top, the least cost-effective plans at the bottom, if you click in any of those plans to look at the specifics of that plan's costs, you can also hit the button that says enroll and enroll directly through the Medicare.gov Plan Finder website into any particular plan, as long as you're in an enrollment period. For G, which I'm assuming you're referring to Medicare supplements or Medigaps. For Medigaps, Medicare supplements, you have to go to the companies directly that are selling those plans. So last week I provided a handout that the Division of Insurance puts together that gave you a list of all the companies that sell Medicare supplements in the state of Colorado. You'd have to call those individual companies to enroll in a Medicare supplement plan, such as Plan G. So hopefully that answers your question. And if you signed up for a plan during your birthday enrollment, when can you change plans? So again, if your eligibility into Medicare is in July, so your Medicare A and B start July 1st, you enroll in a Part D to start July 1st. In October 15th through December 7th open enrollment, you can look at what plans are available for next year and enroll in a different plan for next year, and be able to use that annual enrollment period every year to see if there's not a better plan for the next year. So the first year that you're eligible for Medicare, regardless of what month that eligibility is in, you'd have that initial enrollment window to enroll in a plan right away. And then you'd always have the open enrollment window of October 15th through December 7th to make another plan change for the next year. So hopefully that answered everybody's questions. We will go ahead and move on. Another handout that I included in my email today. This is also put out by the Division of Insurance each year. In Colorado, we are actually pretty fortunate that our Division of Insurance has gone to the time and trouble to put some of these publications together. Unfortunately, for 2021 enrollment period, which was fall of last year, due to the COVID situation, some of these publications were either late in coming out or not as comprehensive as they usually are. This Part D newspaper, basically it's like a little 2-page newspaper. Typically will list all the Part D and Advantage plans available in the state of Colorado and by county. And it will usually give you some basic information such as the premiums for each plan, whether or not there's deductibles, that kind of stuff. Kind of the same information that I provided last week for Advantage plans and that all at a glance sheet, but for Part D and Advantage plans through the state. Unfortunately, this last year's paper did not have as much information because so much information came to us so late in the year from Medicare. And so when Medicare sends out information late, it makes it that much harder for the state to get that information in on time for publications. And so usually that information is not as comprehensive as it could be. Hopefully this coming year will be much better. Again, other ways you can get that information about what plans are available in the state of Colorado is by getting a Medicare and You handbook for 2021 specific to Colorado, because at the back of that book, it will also list all of the Part D plans and Advantage plans available per state. You can always go to medicare.gov and use the plan finder, and they will always search plans based on your exact zip code. Or you can always call 1-800-MEDICARE 24 hours a day, 7 days a week, 365 days a year, and they're always happy to answer those questions as well. Or, as always, you're always welcome to contact your local SHIP office, that's us, and we're happy to help you through that information. Quick note about the Medicare, our Senior Medicare Patrol. This is a program that's designed to help people protect, detect, and report potential Medicare frauds and abuse. And we do education and information, presentations. We're always looking for volunteers. And it can be a very interesting and very satisfying volunteer opportunity. And there's always something going on. So there's always someone out there trying to do something they shouldn't be doing. And the more people we have helping us find those people, the better off we all are. If you want more information about that program, I've listed the national website for SMP. I've also listed our statewide toll-free number, or again, you can contact our local SHIP office and we're happy to give you more information. And that's about it. Again, we have 5 full-time counselors and a part-time volunteer here in El Paso County. We're always happy to talk to you over the phone. We are currently allowing for in-person assistance by appointment only. Masks required right now because of the new development in COVID. But it's by appointment only. Or you can always email me at the email address provided, and I'm always happy to answer emails. I can usually answer them within 24 hours. Call our toll-free statewide number, and based on where you're calling from, it'll route you to the office closest to you, or you're always welcome to call us locally here in Colorado Springs. And that's about it. Any last minute questions? All right.
Roma, I have
Yes.
a question. I have a question about, it doesn't pertain to Medicare Part D. Should I just email you about that question?
Yeah, could you do that just so that,
Yes,
yeah, no,
I'd be happy to do that. I don't want to hold you up or anybody else up because it's
Yeah, no,
not specific to this particular case
yeah,
or
no,
Medicare Part D. I'll be happy to email you my question. Thank you so
absolutely.
much.
You're most welcome. And again, with that, I'm going to let you all go for the evening. We really appreciate you joining us tonight. Hopefully you found this information useful. Keep in mind that we will be, this was recorded. We will be posting this presentation in the next couple of days, as well as the handouts. If for some reason you did not get my email with the handouts, which again, I sent out literally 15 minutes before the presentation. So if you did not get them, feel free to email me and I'll resend them. Or you can always go to our website in a couple of days and they will be available for download there. Otherwise, please let us know if there's any questions that we can help you with. Again, you're welcome to email me, give us a call, and we're happy to talk to you one-on-one. Otherwise, I appreciate you joining us tonight. Hopefully we'll see you next week for our part 4 of 4, when we talk about all the other types of insurance that can be available to go with Medicare. And then we'll be done. Everybody have a good night and we'll hopefully see you next week. Thanks.